Hi everyone, Dr. Hall with you again. We're going to do the posterior triangle of the neck. So I'm starting with the clay that I used for the carotid triangle. So just a quick review: hyoid bone, superior and inferior belly of the omohyoid muscle in pink, hypoglossal nerve, external carotid traveling anteriorly, internal carotid posteriorly, and then deep up into the skull, vagus nerve, internal jugular vein, and the sternocleidomastoid muscle with its sternal and clavicular heads. You'll also see this spinal accessory nerve, cranial nerve 11, which is traveling along the deep surface of the sternocleidomastoid muscle. So now I'm going to build on top of that to show you the structures in the posterior triangle. So I want to point out one addition here, which is I added in my subclavian vein, right? Which then, once the internal jugular joins, it becomes the brachiocephalic vein. Also helps stabilize my cardboard. Okay, so now since we're moving more posteriorly, again, this is a left lateral view, I'm going to add the trapezius muscle. So the trapezius muscle is primarily a muscle of the back and the back of the neck, but we can see a little bit of it from the side. Fiber direction is like this. Now, of course, the sternocleidomastoid attaches to the sternum and the clavicle, and part of the trapezius also attaches to the clavicle and the acromion. So we can see how in this posterior triangle then, right, we can see that spinal accessory nerve traveling from the one muscle that it innervates to the other muscle that it innervates. So we just have a few other structures to add. The first is going to be the external jugular vein. So the external jugular vein is going to be found on the anterior surface of the sternocleidomastoid muscle, and then it comes down, and in that triangle will join and drain into the subclavian vein. So there are very few structures on the surface of the sternocleidomastoid muscle. The external jugular vein is one. The other is a nerve called the great auricular nerve, auricular AUR, meaning it's going to the ear. And it's going to travel right along with that external jugular vein. So that's where we're going to look for it. The other nerves that we're going to find are these three lovelies, which are the supraclavicular nerves. And they're going to come out from the deep surface of the sternocleidomastoid and supply this area here, right? Supraclavicular above the clavicle. So the only thing left to add now for the structures you needed to learn is the platysma. The platysma is a very superficial muscle, very thin, and in fact when we do the dissections it usually comes off with the skin because it's right on the undersurface of the skin. So I've kind of used a little plastic bag. Hopefully you can see that the fiber direction is longitudinal, and it attaches from along the jaw all the way down to the clavicle and the sternum, and it's just a muscle of expression. And so when we meet in class, I'll make some expressions using my platysma muscle for you. All right, so let's review. Most superficially, we have the platysma muscle. Then we can see the posterior triangle here. We've got the trapezius muscle, the sternocleidomastoid muscle with the sternal and clavicular heads. On the surface of the trapezius muscle, we have the external jugular vein draining the face and scalp, right? Just like the external carotid supplies the face and scalp, right? Those external structures as opposed to the internal structures, the brain. External jugular draining the face and scalp, traveling with the great auricular nerve here. Then inferiorly, we see these supraclavicular nerves, and we can also see peeking out and traveling through here the spinal accessory nerve, which is providing motor innervation to both the sternocleidomastoid and the trapezius muscles. So that's the posterior triangle.